My mother was a teacher. She spent several years doing grade school, elementary age children. My parents were married for 58 years. Their first date was actually on Columbus Day, and my mother passed just after midnight on Columbus Day, probably 59 years after they had met. My mother was in fairly good health, but she had a stroke one Thursday morning and was taken to Medical City by the EMTs. It became clear that she would not gain back the level of life that she would have wanted to have.
In helping Amy and her dad to make decisions about their mom was really giving them the medical information about the catastrophic nature of the stroke and the fact that she was not improving over several days, meaning that she would likely pass away from this. And so it was a question of giving them medical options to say, these are potential things that we can do, not necessarily should do, and then helping them to decide what would her wishes be to come together to a decision where they would represent the wishes of Amy's mom.
Dr. Fernandez recommended a conversation with the palliative care team. Clearly making one of the hardest decisions of your life, we couldn't do it by ourselves. We really needed that nurse to engage with us and helped us get to a decision that hospice was the right answer for my mother and that this time was the right time to do that.
I try to engage everybody that's in the room and assess how to best come alongside them and help them process what's going on.
Joe's team comes in when the family decide they want to pursue hospice palliative care. Their expertise is providing care at the end of life.
In the case of Amy's mom, she wasn't stable enough to leave the hospital. She wasn't in a place to go get these services and care in a different setting, and so her needs really dictated that she needed to be admitted to general inpatient care.
For her to be able to stay in the same room was very comforting. We had had such good care, and to have that not be disrupted was comforting for myself and my dad and my sister.
Our mission is, above all else, committed to the care and improvement of human life. And that means meeting patients where they are at all phases of their life, at the very beginning, in the middle, and at the end. And we work as a team collaboratively with our doctors, nurses, palliative care, and social services provider to bring all those services together to address end-of-life issues. I think where we've really improved as an organization is that we're doing a much better job of recognizing when it's time to shift the focus of care from cure to comfort and providing quality of life.
Hospice is a service more than it is a place, and our services can follow a patient and family anywhere they go. So we need education with patients and families to help them understand the benefit that's available to them, whether it be through Medicare, Medicaid, or marketplace insurance.
We often tell our staff to provide the care that they would want for themselves, but I think it's even more important to understand the individual needs of patients and families and provide the care that they want.
It would have not been a good option for our family to try to move my mother home for multiple reasons. And so to be able to keep her right where she was and let her go in peace was a gift for us. I think one of the important elements of hospice is the family component and the dignity component. And we were able to maintain both for my mom, so her family could be with her and have her exit this world really gracefully. Medical City provided great care for my mom. In the end, the care that she needed was to be able to die peacefully. And Medical City gave her that gift, allowed her to do that.